I am a proud husband. I've been married for 10 years to an amazing woman, and we have 3 wonderful children together. Our son, he's the oldest, his name is Messiah. Our middle daughter, her name is Cheyenne. And our youngest, her name is Sage. I guess the one unique thing about our family is that my father just so happens to be an NFL Hall of Famer and Heisman Trophy winner for his time at the University of Texas and Houston Oilers, Earl Campbell. My name is Tyler, and I have been diagnosed with multiple sclerosis. I was at San Diego State University, and I remember being 21 years old and just finishing out our junior season. We had played BYU, and I walked out of that football game absolutely normal with no issues whatsoever. I wake up on a Sunday morning after that football game, and I ease my legs out of bed, and instead of standing to my feet, I fell flat on my face. Without warning. Like, can you picture yourselves going to sleep one way, absolutely normal, and then waking up the next day not being able to walk?
Multiple sclerosis is an autoimmune disease, meaning the immune system, or the part of the body that normally attacks viruses and bacteria, gets confused and attacks a good part of the body. With MS, those immune cells attack the myelin, or the coating of the nerves, in the central nervous system. So nerves that are myelinated are ones where the signals can run really quickly so that we can do the things that we want to do, like move our hands or nod our heads. And so when those signals are interrupted, it essentially slows down the signal. If that myelin or that coating is damaged severely, or even if the nerve fibers are damaged severely, those signals won't work at all.
And then I noticed that the paralysis was down the right side of my body. And then I noticed that I started to develop a neck jerking twitch that was just kind of like uncontrollable. I was terrified.
It was a beautiful day. I was walking to the metro, and I remember the right side of my body just wouldn't catch up with the left side. It was as if the right side would drag. I knew something was wrong. My name is Dawn, and I've been diagnosed with multiple sclerosis.
Yeah, and how many pages was in it?
You read 100 pages, and I read it in a day.
And you read it in a day.
Someone made me do it.
I am a 46-year-old woman. I was diagnosed with MS at the ripe age of 25. I have one son. I was in the middle of a flare, as they say, or a major exacerbation. And I woke up the next morning completely numb in my extremities. I couldn't feel my abdomen area. I couldn't take deep breaths. I thought I was dying.
I'm heading into the doctor's office, seeing a neurologist for the first time. I'm going in there dragging literally the right side of my body. So the neurologist is coming into my room now. And as she turns to look at me, I notice that her eyes, they jump. Almost as if she's shocked or she's surprised by the figure that she's seeing. Did her eyes jump because I was a black male? And there weren't as many of us getting diagnosed with this disease at that time as there are now.
So the demographics of multiple sclerosis in the United States are changing. Typically, MS has been thought of as a young white woman's disease. And if we look at the prevalence or incidence of MS globally, that is still the case. Eastern Europe is the most common or has the highest incidence of multiple sclerosis. But when we look at the demographics here in the US, there are studies over the past decade that suggest that the incidence of MS is actually highest in African Americans. There are multiple studies that suggest African Americans have more lesions on MRI, they have more visual problems, they have walking disability and have the need to use canes or walkers up to 6 years earlier than their white counterparts. I don't think anyone knows of one cause for MS. Otherwise, I'd be happy to cure everybody and send them home. But we know that there are several things that increase the risk for one person having MS versus another. One of the things is low vitamin D levels, for instance. People who live in certain parts of the world, like further away from the equator, have a higher risk of multiple sclerosis, and that may be related to vitamin D. We also know that there are other modifiable risk factors such as smoking and obesity, and we really don't know how those are related to increased risk.
So from there, she gave me a host of motor skill tests. She told me to walk in a straight line, and every time I tried to walk in a straight line, I fell over miserably, right? All those tests. And then she said to me, I think I have an idea of what this could potentially be, but to get a greater look at it, we're gonna need to give you a spinal tap, and we'll probably have to go through some MRIs.
So there's not one test that diagnoses MS, but there's several things that we do. First, an MRI is key to diagnosing MS because we see lesions or spots in the brain and/or in the spine that tell us that the immune system has damaged some part of the brain or spine. Here in the brainstem, we see some white lesions, and we can see a lesion there, which is very typical of what we see with multiple sclerosis.
The doctor said, I think that you need to go and get an MRI. And the radiologist found something, and I read the report, and I thought, okay, autoimmune disease. I don't know anyone in my family who has this. Everyone's healthy.
Dawn is bright, energetic. Had it not been for multiple sclerosis, I'm almost positive she would have probably had double PhDs. She's just got that much energy, that much drive. As we look back through our family, there doesn't seem to be any strong history of MS in our population, in our family.
In terms of genetics, if you have a first-degree relative who has MS, your risk for MS is elevated, but it's still very small compared to the general population. Hello, how are you? I'm Dr. Williams. It is so there's some combination of genetic factors plus environmental factors that lead to one person to have MS versus another that doesn't. The issue that we don't understand is what factor do social determinants of health, such as access to care, play in that, versus underlying biologic differences and how those play together to lead to the disparate outcomes.
I don't feel that I am the first one in my family to have this disease. Understand that my family, my ancestral heritage is rural East Texas. Our family, especially on my father's son, comes from extreme poverty. And so not all the time would somebody have the funds to go to a doctor. And so culturally, I don't feel like I'm the first one. I feel like I'm the first one who got diagnosed.
My father knew an MS specialist, and I made an appointment. I won't forget that day. My father came with me, and he had asked, well, what is it? What is it? And she said, oh, it's MS. With a very assured look on her face. She absolutely knew it was multiple sclerosis. I was taken aback.
Sitting in the doctor's office, the one thing that gave me hope, and certainly gave her hope, was the physician said to her, Dawn, we're going to get old with this disease together. That in itself gave me hope.
I didn't realize at the time how much of an impact my diagnosis had made on my family, and particularly my father. I think they knew way more than I did at the time about MS. I eventually learned that your support system, your caregivers are hurting just as much as you are.
My wife's willingness to be open to go to doctor's appointments, her willingness to be able to comfort me and allow me the space to cry tears. MS was not a disease that you were supposed to fight alone.
Tyler and I met at San Diego State University in college. He was on the football team, I was on the track team, and we met in the athletic center on campus. I thought he was attractive when I first met him. Thought he was a little sensitive. We kind of bumped heads a little bit the first year we met. But after a while, you know, we became really good friends. I actually was one of the very few people who knew Tyler was diagnosed with multiple sclerosis back in 2007. He didn't tell a lot of people that he was diagnosed. We did not know a lot of African Americans who were diagnosed with multiple sclerosis.
When I read what multiple sclerosis was, what the statistics were, particularly what the statistics were for me as a black male with MS, I couldn't find anything. All the pictures I saw, all the research, all the statistics weren't included, and nobody looked like me. I know I'm in really big trouble.
MS affects women 3 times more commonly than men. It used to be twice as common, but now we know the demographics again are a little bit different, and usually between the ages of 20 and 40. Often people who are in college or people in their early childbearing years, getting ready to start their careers, are when they're first diagnosed.
I was right in the middle of graduate school and headed towards my doctoral program. And I couldn't keep up with the work because MS affected not only my gait, not only my ability to function like a normal everyday person, it affected my cognitive abilities. And so I would be sitting in class and not understanding what the instructor was saying. So I had to pause, and I did not finish.
The hardest part I think about MS is that with relapsing and remitting, which is what I have, when people see you, and it's not one of those bad relapsing days, so they can't see the disease. So they can't figure out, well, what's wrong with you? You're walking, you're talking. I don't notice the limp.
About 85% of patients who are newly diagnosed have relapsing-remitting multiple sclerosis, which is a type of multiple sclerosis that usually you'd have some symptom, whether it be optic neuritis, blurred vision, double vision, numbness and tingling, trouble with gait or balance and walking. So relapse means they have a symptom, they get treatment, and then there's the remission part.
So when we think about a remission in cancer, we think of the absence of symptoms. That's not what a remission in MS necessarily means. A remission with MS could be if you had numbness and it got 80% better, you stay at that 80% for several months to several years. So it does not mean the symptoms are gone. It just means you experience a period of stability.
And you are so incredibly proud that you've been able to make it through a football season your senior year. You graduated with this disease. I'm living on cloud 9, so much so that at times, I forget that I have the disease. You're getting ready for the National Football League. You get a chance to work out for NFL scouts. And then you have a relapse that totally takes the game of football away from you completely. You're in a wheelchair. You have to learn how to bathe yourself, You have to ask help from somebody to help you use the restroom. You have to have somebody to feed you because you can't do it for yourself. Working out for NFL Scouts to now somebody's feeding you and bathing you. Emotional roller coaster.
One of the difficulties with multiple sclerosis is the fear of the unknown. Let's do this. Let me examine you, and then we'll see what we see on your exam. Okay? So I'm a huge advocate of counseling and accessing mental health services for my patients from the beginning, from diagnosis, because it's a lot to grapple with.
We do find patients who have come into the office by referral who should have been diagnosed many years ago.
The difficulty with late diagnosis is that we also find that when we look at these groups and we look at outcomes, they have more severe outcomes than in other groups, not just in terms of disability, but also in terms of mortality. And people don't usually die of MS. And we see that African Americans actually die at younger ages, likely because of higher disability rates, which may be related to delayed diagnosis.
It's important for all patients who are diagnosed with multiple sclerosis to know that there are medications available, which is very important when you're talking about multiple sclerosis.
And when we think about the disease not having a cure, which sometimes is one of the hesitations that patients have to doing treatment, I say, well, name me 5 diseases that are curable, right? It's difficult. We treat and manage diseases, just like we do with hypertension, diabetes, other conditions. We manage MS, and the medicines and therapies that we use allow us to do that more effectively. So the course of treatment doesn't necessarily differ in the African American community. The course of disease can differ. And because of that, there are many people who favor doing high efficacy treatment early in that group because of the risk of disability. And essentially what that means is we just hit it hard from the beginning. There are several therapies within that higher efficacy categories. Some of those are pills, some of those are infusions, and even some of those are injections that people can take at home.
It took me a long time to accept that, yes, medication will help slow the progression of your multiple sclerosis. I was in denial for a number of years, probably almost a decade. I was walking, but not unassisted. I had a mobility device. I used a cane. And so after having pretty frank discussions with my neurologist, she pushed me to be proactive and not reactive and not waiting until, well, you're in a wheelchair, and that was the path that I was on. By being non-compliant and refusing and resistant, I decided to embark on a new disease-modifying therapy to treat the disease. I haven't had an exacerbation in probably 7 years, which is incredible. And that's due to being compliant, eating healthy. I am very, very strict on the things that I eat.
There are foods that are obviously not helpful to somebody living with MS. As I learned about vitamins and learning about food groups, it has helped me to feel better. Having some form of exercise has been helpful to helping me feel like I'm still holding on to that athletic Tyler just a little bit with MS.
How are you, gorgeous?
I'm great. You look fantastic. How are you?
So do you. I said, I'm going to start a podcast. I'm going to share what it's like having MS with the world. I want to hear others' journeys and stories. And I recently had a guest on the show, my dear friend, fellow MSer. Today, I'm joined by a fellow MS advocate.
Thank you so much for having me, Dawn. It is always a pleasure to speak with you.
One of the most difficult aspects of having a diagnosis like multiple sclerosis is trying to figure out not only who you are, you're also wondering who you were.
Absolutely. I absolutely do. And I think it's very common. And I think that's why it's so important that you're having this discussion, because it's one thing to be in the prime of your life and be healthy, and then bam, you're just sideswiped by this chronic illness diagnosis. But there were certain things that now aren't important to me anymore, I'd say. And it's changed my priorities, yes, but I still at some times grieve the hopes I had before my diagnosis.
I truly enjoy the podcast life. I feel that I've met a number of people who are willing to talk about MS and willing to share, because it's not easy. That's all I can say too.
When the doctors told me that they were going to take football away from me after that last relapse, I literally told the doctor, I said, it's going to be okay, because when one door closes, another one opens, and I still can't figure out how in the world I said those words. But I think it has a lot to do with faith and culture of what I come from, and understanding that what you go through is not about you. It's about how you handle what you go through to give hope to somebody else to say that, yes, I can.
I was sitting in the hospital with him and he told me, Shayna, it's all right. I'm gonna be okay. There's bigger plans for me. I don't know what yet, but there's more for me.
The man up above literally spoke into my heart, and people think I'm crazy, but this is my truth. So take it as you want to take it. He said, as long as you help spread awareness about this disease, my soul will be at peace. And so if my soul is at peace, then I can keep on moving forward. And so ever since then, the mission has been leaving things better than the way that you found them for multiple sclerosis. I was ready to take the next step in my life towards patient advocacy. You don't really know how strong you are as a human being until you are dealt situations and circumstances that cause you to be made weak. I fell into public speaking by accident to impact lives through a microphone and a voice, and I just try to do that as much as I possibly can, day in and day out. So knowing that I could be an inspirational speaker, knowing that you can be an author, knowing that you can do all those things to make an impact and leaving things better than the way that I found them, that's basically the way I live my life every day.
Myself and several of my colleagues from around the country who've recognized and been doing this work for some time came together and founded a registry so that we can understand some of the risk factors for MS in the Black population, as well as understand if people are getting to treatment in time, if their diagnosis is being delayed, and to try to better get a handle of the data and the reasons why we see some of the outcomes that we see. And so I'm very hopeful that there is much work being done to decrease health disparities and to improve understanding of MS in minority populations.
Being able to walk again with my family and watch Destin on a skateboard, it means a lot. And I think having him see me in a state of not being able to walk to walking it's overwhelming.
And that was the issue for this originally with all the other monuments.
Right, exactly.
And they said, no, you got to put this thing.
I'm learning how to constantly navigate living a life with MS. There's hope with this disease. There's promise with this disease. There's family with this disease. There's independency with this disease. There are things that allow you to still live your life with MS. Please know that with this disease.